on the inpatient ward and also in the community setting. So when we think about bipolar, we're really talking about extremes of mood. We're talking about people meeting the criteria for what we call a manic episode, which is really an extreme high that's often characterised by not needing any sleep, a change in mood, which might be elation, but it might also be irritability. They might speak really fast, they feel that they're thinking really fast. They might engage in a lot of goal-directed activity, so walking for tens of kilometres, starting new businesses, lots of different ideas. And whilst in some ways that behaviour can sound good, it can become quite destructive over time. And the flip side of that is that people can experience quite severe depressions as well. So low mood, not having a lot of energy, changes to sleep and appetite, and even suicidal ideation. Similarly to other severe mental illnesses, there can be a number of different risk factors for bipolar. We often see that there's a family history of bipolar or schizophrenia, and we know that there's a lot of genetic linkages between those two illnesses. For some people it might be early trauma that they've experienced, it might be sustained drug use. For others it can be head injuries or other organic causes as well. And so often when people are coming to see us, there might be a number of those risk factors in their history, and those are some of the things that we ask about. It's really possible for people to experience good recovery from bipolar and to very much live a normal life. There are lots of, I think, different levels of severity in bipolar, and there are a number of people that might experience one episode of mania or perhaps several episodes of depression, but with treatment can fully recover and go on and continue to work, to contribute, to have relationships. Even people that have perhaps a more severe illness can maintain excellent control if they use medications longer term, but also manage lifestyle factors and risk factors such as monitoring their sleep, maintaining a healthy lifestyle, including things like exercise, watching their diet, and engaging in social and other leisure activities as well. I think like all mental illness, there can be a lot of myths, and I think a really common one around bipolar is that any variation in mood means that you might have it. And I think those ups and downs are a really normal part of being human. It's really normal to have times where you might feel elated, where you might feel really on top of your game, really sharp, and there's also times where you might not feel that way, where you might feel low, your mood might not be as great, you might have trouble getting out of bed. And I think those fluctuations in mood are just a normal part of everyday life. And you really only need to be worried or I guess to seek help when it's really starting to feel like it's impacting in your life and maybe the others around you as well.